Hello and welcome to the program. Thank you so much for tuning in today to Health Professional Radio. I'm your host, Neal Howard. Today, our guest is Dr. Joe McEvoy. He's a professor of psychiatry and health behaviors at Augusta University, and he's joined us today to discuss the current schizophrenia landscape, some of the recent FDA approvals and developments concerning schizophrenia, and some real-world experience in how his patients face some of the very unique challenges as a result of their disease. Welcome to Health Professional Radio, Dr. McEvoy.
Thank you, and I appreciate the opportunity to be here.
For those of us who are not familiar with schizophrenia in any way other than what maybe we see on TV and in movies, what is schizophrenia?
Schizophrenia is a biological brain illness that starts probably even before people are born in utero. And during childhood and adolescence, they have progressive problems with many areas of their brain function, including their cognitive function, the grace and fluency of their movement, their motivation, their interactions with other people. In folks who will become psychotic, these deficits worsen during the months or years as they head in towards psychosis. And then finally, often in the teens or early 20s, they start to develop the characteristic defining psychotic symptoms of schizophrenia: hearing voices, disorganized thinking and behavior, delusional beliefs that, for example, people want to kill them, or that they're receiving messages from electronic devices that the rest of us do not have access to, etc.
Some of the characteristics sound very similar to many other mental disorders. What is it specifically about schizophrenia that sets it apart?
Well, the characteristics of psychosis, disorganized thinking, auditory and other sensory hallucinations, delusional beliefs, are common in multiple disorders that display psychosis. The key feature that sets schizophrenia apart are these other cortical deficits. People with schizophrenia have more impairment of their cognitive intellectual abilities. They're more graceless, awkward in their movements. They have less motivation. And they have one critical feature that makes it very difficult to treat them, and that is, the fancy term is anosognosia. The more reasonable term is an absence or lack of awareness that they have an illness and that they need treatment. It's not dissimilar from hemisensory neglect, which we see sometimes in people who have right-sided strokes, where if you ask them how is their, are they having any trouble with their now non-functional left arm, they may say, what left arm? And if you show them their left hand, which is limp and unable to be useful, they'll tell you that's not my hand. I don't know whose hand that is. But it's the same thing with schizophrenia. People may have 15, 20 hospital admissions, psychiatric hospital admissions, and they do not come to the conclusion from that they might have a biological brain illness that requires treatment. They assure you they're really not ill. There are no problems. The experiences that they're having of their hallucinatory experiences, their delusional beliefs, simply reflect reality, and they accept that with absolute firmness. This makes it difficult to treat them. It's very different from when a person with a broken foot comes into the office of the orthopedic surgeon, and the person says, "Oh, doctor, I have a broken foot. I need help." And the orthopedic surgeon looks and says, "Yes, that's a broken foot. I'll put a pin in, and we'll cast it, and in about 6 months, you'll have a functional foot again." In that, both the patient and the doctor share completely 100% of the conceptual framework and 100% of the plan and the goal. The psychiatrist, often a patient, it's very rare that a patient with schizophrenia comes in seeking treatment. More commonly, family bring them there, or the police bring them there under an involuntary commitment. And they assure the psychiatrist there's not anything wrong, and they're very puzzled by why the psychiatrist would want them to take medicine that might, quotes, treat a, quotes, problem that they do not believe they have or that needs treatment.
Is the schizophrenic patient more of a danger to themselves or more of a danger to others if they become psychotic and dangerous at all?
Well, many people with schizophrenia are just, it's a biological illness. It happens to a wide range of people, and the vast majority of people are harmless to either themselves or others most of the time. But they may deteriorate substantially. They may be so engrossed and so disorganized that they, do not take care of themselves. They do not maintain their home, their grooming, their hygiene deteriorates. So there's that kind of problem. Some people, especially at the start of schizophrenia, their hallucinatory experiences and their delusional beliefs lead them either to be driven to attempt to kill themselves. And about 5 to 6% of people with schizophrenia die by suicide, and it tends to be early in the course of the illness. The rates of assault and even homicide are higher in schizophrenia than in the general population, but they're not very high. And again, it has to do with a person whose belief system leads them to an understanding they accept that perhaps a neighbor or a family member has been doing something horrible to them and tends to harm them, and they attack the person. Many other factors may lead into this, like a person who also had some criminal behavior or criminal tendencies before they got sick with schizophrenia may be more dangerous. A person who was abused as a child or went through many traumatic experiences may be more likely to harm self or others. So it's not, it's not strongly, it's a common component of schizophrenia.
But it's not unheard of.
It's something it's not unheard of, and we have to watch out for it, yes.
How many people are actually diagnosed as having schizophrenia? I mean, not the people who may be borderline and we're still looking at them, but people that we know solidly are suffering and living with schizophrenia. Well,
schizophrenia is an interaction between what's probably a genetic risk, either something that you inherit through your family or a new spontaneous mutation. And then what happens to you during intrauterine life, development, birth, and events afterwards. The incidence rate, prevalence rate of schizophrenia 50 years ago was about 1 in 100 people over the course of their life met criteria for schizophrenia. And that was pretty consistent on all continents, across all races, ethnic groups, etc. The rates have been declining slightly because, as I mentioned, this is an interaction. And if somebody has risk, but they get exceptionally good prenatal care, labor and delivery are handled wonderfully, they avoid head injuries, these things may decrease the percent of people who are at risk to schizophrenia, but in whom it then becomes manifest. If you have complications around childbirth, if you have head injuries, if a whole bunch of brain insults happen, it may bring out schizophrenia, which then has a momentum of its own. The biggest risk nowadays is the increasing problem with substance abuse, which may bring out schizophrenia in people who otherwise would not demonstrate schizophrenia.
Are we talking substance abuse across the board, or are there specific substances like alcohol or maybe heroin or cocaine that have a more chance of bringing out dormant schizophrenia?
The most frightening ones, the ones we worry the most about, are the stimulants, cocaine, amphetamines, methamphetamine, ones like that. if you look at marijuana, there's a clear relationship with overall dose of marijuana. People smoking every day at high levels of marijuana use have greatly increased risk for transitioning into schizophrenia if they have the genetic propensity to do that.
Now, where can we go and get some more information online about schizophrenia?
I would suggest you start by going to the National Institute of Health websites and primarily National Institute of Mental Health, putting in schizophrenia. You could also go, if you go to Google and put in schizophrenia, NCBI, that will take you to publications in the peer-reviewed literature about schizophrenia. As in anything, there's quality stuff on the internet, and there's unfettered baloney on the internet. I think if you stick to the National Institute of Health or the National Alliance for the Mentally Ill, NAMI, NAMI, or you go to perhaps Mayo Clinic and read some of these quality institutions' reports and information about schizophrenia. Medscape, MEDSCAPE, is another good source online for information.
Great. Well, I appreciate the information and you taking your time to come and talk with us today, Doctor.
All right. It's nice to talk with you.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Joe McEvoy, Professor of Psychiatry and Health Behaviors at Augusta University. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.